good afternoon. It is afternoon, so I can say good afternoon, and we can have a beer now, as Marion said you can. First of all, I'd like to thank my committee, Melissa Travis, who's here, Steve Boyle, I don't know where Steve is, he's out there somewhere, that's Steve in the back, Jamie Moran, somewhere back there, and Al Chabonneau. You're very instrumental, and I appreciate all your work in helping us through this process. First of all, we're all here for a few reasons. Number one, mostly because we care about the state of Rhode Island. It's a state that we want to live in, and we want our children and grandchildren to live in. We want a healthy economy, a good quality of life, and we want healthy citizens. So those are the things that I think we're all here for. So I want to thank Senate President Ruggerio, Lita Mattiello, Cap, John, Mark Hayward and staff, wherever he is, it doesn't have a sign up yet, so I'm doing good. And the Center for Women in Enterprise for putting this event on. So we want to, first of all, address the fact that we had a couple of successes, but a recap is, last year we sought a 1332 waiver for the small crop provision, allowing smaller businesses to purchase health insurance on the group market. We through the work of the House, the Senate, and state leadership, we were able to get that waiver, and now working with the federal government to see if we can go forward with that waiver. And I want to thank Health Source Rhode Island for helping us through that. Other areas that we wanted to address is facility fees, and it looks like that became an issue where some folks were going to certain facilities and getting charged for the use for that facility, and it was a fee that they were being charged. And we want to thank Dr. Gannon and her staff at OHEC for addressing that issue, and in a through regulation she was able to address that particular issue. The other thing we want to look at is impact statements. We currently have over 70 mandated benefits on healthcare in the state of Rhode Island. We would like to see where, if there's any further mandated benefits, whoever submitted that piece of legislation for the mandate would submit an impact statement on what would the cost be and what are the benefits of that particular mandate. I believe, if I'm not mistaken, we have more mandates than any state in the union. Balanced billing. I don't know if any of you have seen that happen, where all of a sudden you go to a hospital, you think you have everything paid, you pay your copay, and all of a sudden you get a bill in the mail saying that you owe additional fees for some particular reason. We need to address that, and Al Chabonneau has been very instrumental in addressing that, and he's going to help us through that process. One of the things that was important to me is, if we'd like to see some type of legislation which would allow an employee who turned 65 to go on to Medicare if they wish, and allow the employer, thank you, Mark, they could give the employee the option of allowing their children and family, spouse and family, to stay on the group health care if they choose to do so. So what happens now, if a person wants to go on Medicare and they're 65 and they're working for a company, they would go on Medicare, and then their family would have to go find independent coverage someplace in the marketplace. That's very disruptive to them and the family, and it prevents them from even thinking about going on Medicare at that point. A couple other things is, I'm currently involved with the Market Stability Work Group it's being sponsored by OHEC as well as the Health Source. And what we're trying to do with that work group is to make sure that we have stability in the individual marketplace for healthcare premiums. The issue is with the federal mandate that went away, we're concerned about the fact that if that mandate goes away, the healthier population will probably be not taking health care, and ultimately from that perspective, we would see the cost of health care go up for the whole group in the individual market. So we would certainly appreciate further support on that particular item. Choosing wisely, quickly I'll go with this. I know Mike's going to jump up and get me nervous now, but that's okay. Choosing wisely, we want to continue with choosing wisely, and and Al's responsible for that. But I think one of the things that I think is most important in this whole discussion is substance abuse in the workplace. That's something that I feel that we need to address. We need to address it from a perspective to add support so the employer can assist any employee without feeling that they're going to be in a position where they're going to take on additional liability in assisting employees to help them through the process of substance abuse so they can keep those employees working healthy and in the organization. So for a matter of time, I want to say thank you, everybody. I appreciate this opportunity. And